Recently, we have run out of time during these sessions. So welcome to the May Research Town Hall. Today, we have several exciting presenters. And I want to start out with Dr. Klein, if you would please give us some updates that you might be able to share with us. I would appreciate it.
Sure, and then I'll throw it back to you for our presenters. Good morning or good afternoon now to everyone. Let me give you just a few updates and primarily focused on federal and state opportunities as well as successes. As far as federal grants, we've had some notable successes that we'll be publicizing across campus in the next few weeks. The first one is our fourth COBRA Award. That's from the National Institute of General Medical Sciences. These are really one of the foundations of our NIH portfolio. We've gained a notice of award for our fourth COBRA Award. Congratulations to Dr. Cave and Dr. Hill. I don't know if they're on the call, but everyone send an applause emoji to them. This is ultimately a 15-year NIH grant, as long as you get your renewal every 5 years, which is highly likely. And so major congratulations to them. A number of people across the entire campus are part of this COBRA. And it's very exciting that the notice of award has arrived. The second is major congratulations to Dr. Kenneth Palmer and Dr. Max Boyachi. They also have received an NIGMS notice of award to create a medical scientist training program. We had already started and laid the framework for that going back several years and had been pursuing an MSTP award. We are now one of a little over 30 NIH-funded MSTPs in the United States. When you think that there are many, many, many more medical schools than 30, we have moved into elite company with this. And so congratulations to Max and to Kenneth. And this is very, very exciting to see how this program will shape the next generation of clinician scientists and academic physicians here at U of L. Also want to give a shout out to Lee Botner and her group who helped guide those two grants to success. If you've engaged with research development on proposals, and they primarily focus on large multi-investigator grants, if you've engaged with them, then you know how terrific they are. And then at the state level, I just want everyone to be aware that the process of applying for studies and healthcare innovation that is a part of the Rural Healthcare Transformation Program and Fund is well underway. If you've not engaged yet with Dr. In Kim and his team, don't worry. This is a 5-year program. We're moving very quickly on the first year to get done. And then later on in the call today, you'll hear a little bit about another state-sponsored funding opportunity. And then last but not least, it's always no news is good news when it comes to indirect costs and the management of funding. The good news is that in terms of funding, the NIH and the NSF have done reasonably well. The disappointing news is they're extremely slow at getting the request for proposals and the notice of awards out the window and out the door. But we're patient people, and we're here to persevere. They can't outlast us. Okay, so I'm going to throw it back over to you, Lee, and I'll be quiet. I'd be happy to take questions at the end if anyone has them.
Thanks, John. Next up, we are going to hear from Dr. Kevin Merton, and he's going to talk a little bit about the the program that John mentioned related to Kentucky Senate Bill 6. So Kevin, can you join us?
Yeah, thanks, Lee. Can you see my slides okay?
Yes.
Perfect. All right. Good afternoon, everyone. Thank you, as John said, for being here today. So I want to take about 5 minutes this afternoon to walk through this new state program called the Endowed Research Fund. This is a new statewide research program that we really think is going to shape how the state of Kentucky invests in collaborative research across its public universities, at least for the next 5 years, maybe for the next 10 years and beyond. So apologies in advance. My slides are really text heavy today. We do plan to share them after today's meeting and want them to be helpful to those who are not able to attend today. So here I'm going to focus on the Endowed Research, what the Endowed Research Fund program is, how it's structured, and what it means for us right now here at UofL. All right, so this Endowed Research Fund, as I said, is a statewide investment. It's really focused on advancing high impact collaborative research across Kentucky's public universities. There are 8 public state universities. This program was established in 2024, and then ultimately it was funded through House Bill 900 in the 2026 budget session. So just within the last few months, it's been funded. And the administration and oversight of the program has been assigned to the Council on Post-Secondary Education. So this really represents a new approach in the state's strategy to investing in and advancing research. Under this new model, the state's really focused on funding multi-institutional research consortium that are expected to operate at a significant scale. So they're really not focusing on single investigator or even single institution research programs under this fund. The structure of the fund is outlined in the state statutes. It's designed to support up to 5 research consortiums statewide, and each of those consortium must include at least 2 or more Kentucky public universities. To date, the state has appropriated a total of $37.5 million to the fund. And so that means that each of these 5 consortium are going to receive $1.5 million per year for the initial 5-year term. So a total of $7.5 million for each research consortium. And so when you think about that and compare it to other programs that we have at UofL, that's similar in size to what you might expect to see from a small center grant from the NIH, like a P20 grant. $7.5 million over 5 years can really go a long way. Importantly, these funds are explicitly intended to serve as seed funding. So the state statute outlines that the funds are designed to support the initial research, but they're really targeted to help position these consortiums to pursue larger external funding opportunities from a variety of sources, including federal, industry, and philanthropic grants. So when you think about this program, it's really not just designed to fund single one-off research activities, but really to scale our research competitiveness across the state and to make us more competitive for larger funding opportunities from the federal government. All right, so there are a few key elements of how the program is expected to operate. The funding has not been released at this point, so we're taking this from the governing documents that have been put out there so far. As I said, eligibility, any public Kentucky university can participate. I guess it's still to be determined whether or not the community and technical college system will be included, but certainly the 8 major public universities are included. I think as an R1, one of the 2 R1s in the state, UofL certainly very well positioned to compete within the program. As I mentioned, it's a consortium-based model. Funding is not awarded to individual investigators or single institutions. It's really targeted towards the consortiums and the collaborations between the universities. We expect this to be very competitive. It is a statewide program. As I mentioned, CPE will be releasing a formal request for proposal. We think that'll come by the late summer or early fall. And again, it's going to be highly competitive, limited number of awards, only 5 consortiums will be funded. The statute does outline a few high-level key criteria for the program. So they're going to evaluate the proposals based upon the impact of the proposed research. They mention advancements in health, medicine, and economic development as top-line priorities. The ability to attract additional funding, both for the initial research and the future expansion of these consortia, is emphasized. And they're looking really for the potential to secure larger external funding over time. So as you develop concepts, think about how you can connect those into strategies at the federal level, or at industry or private nonprofit levels. And then finally, they'll be looking at the strength of the implementation plans that we put together, including the level of collaboration between the universities. Each consortium is going to receive an initial 5-year term. They do outline a performance review process, which will take place annually. And then at the end of that 5-year term, they'll review for progress. The statute does state that the state has to maintain 5 active consortiums at all time. So this signals that, this is going to be an ongoing competitive portfolio of projects within the fund. All right, so what should we be doing at this point? As I mentioned, CPE has not released the funding opportunity. We're keeping our eyes out for that, expected to come later in the summer. At this point, we want to get the information out there and strongly encourage everybody to begin to identify and engage potential partners. Because this is a multi-institutional approach, having that strong collaboration is going to be critical. We'd also encourage you to begin to develop your research concepts aligned with those evaluation criteria that I mentioned. Clear impact, strong collaboration, credible pathways to future external funding. And then finally, today we're going to launch an internal review process here at UofL. I suspect Lee will place the details of that review in the chat. So what we're doing is we're going to request the submission of 2-page white papers through the InfoReady system to the Office of Research and Innovation. We'll put a review process together that will allow us to identify the strongest concepts that are emerging across campus, hopefully help you all connect to some additional potential collaborators. And then really we want to coordinate the institutional approach so that the university is putting its best foot forward. The deadline for submission of those white papers to our office will be June 25th, and the details will be outlined in the link that Lee provides. If you have any questions about the competition, it's not a competition, about the review process, please feel free to reach out to Lee and the research development team at the email shown here on the screen. And we think early engagement is really going to be critical given the highly collaborative nature of the opportunity. So I'll stop there. Please reach out if you have any questions, and thank you all for your time today.
Thanks, Kevin. Very exciting opportunity. I appreciate you sharing it with everyone. Next up, we will move to our presenters for this session today. Our first faculty member is from the Kent School of Social Work, and Dr. Heehyul Moon is here to help with discussing her project on dementia and health disparities. Dr. Heehyul, if you would mind sharing your slides, we'd appreciate it.
Yeah, let me share.
Your desktop icons look like my desktop.
Oh, okay. Is- Does it, I mean, do you see my present?
Yes, yes, we can see your screen.
Okay, yeah, that sounds good. So should I start?
Yes, ma'am.
Okay, yeah. Hi everyone, and thank you so much for the opportunity to share my research, this afternoon. Yeah, my name is Heehyul. I am an associate professor at Kent School of Social Work and Family Science. I'm a social worker and a gerontologist by training, and also I am one of Ascending Star Fellows, at UofL. And so today I will share my work focused on dementia, health disparity.
Dr. Moon, we're unable to hear you.
You just froze for a minute, so you might want to repeat what you said.
Oh, okay, yeah. So, so can you hear
You
me
cut
okay
off
now?
after you said that you were an ascending star.
Oh yeah, so I'm gonna just share my work today on, focus on dementia, health disparity, community-based participatory research. So, my research is really looking at dementia prevalence, caregiving stress, service utilization, among diverse population. I use both a secondary data, national data set, also primary data collection, through, community-based participatory research. So my overarching research goal is to reduce dementia care-related health disparity through person-centered, culturally informed, and community-engaged research. So my research has like 3 lines. So first, like using national data set, I've been studying dementia prevalence by race, nativity, caregiving. Can you hear me okay?
Now we can.
Oh yeah,
We did
sorry.
lose you for a minute.
Okay, so first things I was looking at caregiving stress, sleep health, and well-being of caregivers, care recipients. So this work really reveals parents and disparities at the national level. And then also second, through primary data collection with the Kentucky dementia caregivers, both rural or urban, we really try to understand how those broader findings play out on the ground. So the burden, the unmet service needs, and reality of dementia caregiving in the diverse setting in Kentucky. And the third, our partnership with the Yankton Sioux tribe in South Dakota explores cultural aspects of dementia care, screening attention among indigenous community. So I'm going to talk about this the track 3 today. But before diving into the research details, let me share how this partnership came out, because I get a lot of questions about this. So I had been working with the colleagues at the University of South Dakota for several years. And then for 3 years ago, during my sabbatical, I was invited as a visiting scholar there, and I had the opportunity spend extended time with the Yankton Sioux tribe. And then I asked them directly, what research does your community need? And then their answer was dementia, so which really happened to align perfectly with my expertise. So together we co-developed it, what became like Alzheimer's Association's funded project. So why indigenous community? Why now? So as you may know, in this indigenous community experience disproportionately high dementia prevalence, but there is still very limited culturally specific dementia research available. So dementia, again, is often underdiagnosed in this community. And also delayed, diagnosis make the journey harder for everyone, caregivers, care recipients, families, and community. So as I mentioned, this project exists because the community identified dementia as a priority. And this is how community, based parts of the research, works. So not extracting data from community, but building, with them toward better, healthy community. Like starting with a question, what do you need, rather than like, what do I want to study? This is our Alzheimer's Association funded project trail study, has 4-phase mixed method, CBPR design. And in phase 1, we established a community advisory board with tribal leaders, health professional, and community members. And then the CAP played a critical role in identifying community priority, improving recruitment strategies, and ensuring cultural relevance. So this CBPR approach allowed the community to actively guide the research process rather than, simply, participate in. And then this is phase 2. So during phase 2, as you can see, we conducted 6 focus group with 60 participants, younger adults, elders, professionals, and community leaders. Discussion really focused on dementia knowledge, caregiving experience, screening intention, cultural beliefs, and related dementia and barriers to care. And we learned that many participants wanted to, more culturally appropriate dementia education and support services. So then, I think the one strength of mixed method research is that qualitative findings directly inform quantitative research or vice versa. So based on, focus group findings and CAP discussion, we revise our survey to better reflect community experiences, like adding items related to like cultural orientation, caregiving beliefs, and service needs. So in phase 3, we conducted a survey with 248 American Indian adults. Our target sample size was 230, but CAP members wanted to know like the perception of a younger generation. So we lowered the age limit from 40 to 18. And then recruitment occurred at powwows, churches, community events with a strong support from the CAB and then, tribal community members. And then this really community-centered approach, like CBPR, really helped improve trust, participation, and cultural appropriateness through the study. And these are some photos that from our survey collection, data collection. So as you already know, may know, like as a part of our CBPR approach, in April, we returned to the community to share preliminary findings. Yeah, you can see some photos there. And then on the left side, you will see the agenda. This is the agenda that they sent us. So the event was organized by tribal members and CAP members, really reflecting, the collaborative nature of this partnership. And then also rather than, collecting data and living, we believe it's really essential to return findings, receive feedback, and then continue, building trust, share ownership of the research. And our goal is to really generate evidence that actually reaches the people who need it, and in forms that are culturally meaningful and then practically effective. So I'm showing this paper. One important publication from this project was recently published in Innovation in Aging, and it was selected as an editor's choice article. So what we found that like dementia knowledge is like significantly associated with self-efficacy, and self-efficacy is again significantly associated with the screening intention. This is really important because it suggested that culturally informed education programs should focus not only on knowledge, but also on empowering individuals and then increasing confidence in seeking screening and care. We currently have multiple manuscript under review or in progress. And our next step include developing a culturally tailored dementia education curriculum in collaboration with the CAP and community members. But we also hope to expand this work to additional tribal and then rural community and then pursue future grant opportunity. And then we are open to any collaborations. And then ultimately, our goal is to really improve dementia awareness, like other, chronic disease, like or cancer, right? And then early detection, excuse me, early detection and culturally responsive care, and medically underserved community. Um, I also now I wanted to acknowledge some funding, of course. So I wanted to acknowledge our funding sources, Alzheimer's Association, and the scientific training program through NIH, RINGMAR, and then promoting Indigenous Research Leadership Program in partnership with NIH. So their support has been really essential to this work. And also, I wanted to really, acknowledge our tribal members, our community advisory board members, and my colleagues at University of South Dakota. And also, I'm so grateful to University of South Dakota for hosting me as a visiting scholar, which provides a time, right, and a space to truly listen to community needs. And also wanted to thank my co-investigators, Dr. Lee, Dr. Rowe, and Sasha Stone, and also Dr. James Galvin at the University of Miami for his invaluable expertise. And of course, here at University of Louisville, I'm so grateful to Dr. Sunshine Road, our ADR, and then Dean Miller at the Kent School, and then Dr. Lawson, Roberta, Stacy, Christy, and then many others who really have supported this work in many different ways. So thank you again for your time and attention today. I truly appreciate the opportunity to share our work with you, and then I look forward to future collaborations focused on reducing dementia health disparity through culturally informed research and community engagement.
Thank you so much here. Very nice presentation. We'll save questions for the end. And people can also put questions in the chat if you have any. Our next presenter is from the School of Law, and Dr. JoAnne Sweeny will be talking about law research. Dr. Sweeny?
Hello. Good afternoon, everybody. Instead of presenting about my particular research, I have chosen to kind of just give an update about the research that is going on in the law school generally. So let me find a way to share my screen. All right. So let's see. There we go. So I'm just going to be kind of going through, and I'm starting with the more traditional research that is done at the law school, which is law review articles. That is the standard research that law professors do. And so these are the law review articles that have been published from law school faculty over the last academic year. So just highlighting, there's obviously so much research going on at the law school that I was only able to highlight a few things, but I wanted to bring these up. So the law review articles that I'm highlighting on this slide are done by Professors Markison, Ritchie, and Cannon. And as you can see from the titles, we do research in a wide variety of areas. So for example, Professor Ritchie is our chair in intellectual property. And so that is why her research is about innovation and inventions. We also have Dan Cannon, who is actually a junior faculty member going up for promotion next year. And his article that was published in this academic year is about plea bargaining, which is his main area of expertise is plea bargaining. And then Professor Markuson does constitutional law, and he is focusing on elected branches. So those are 3 law review articles coming out of the law school. Let's see. Then there's more law reviewers, and it's me. My article that came out just actually, I think, a couple weeks ago is about street harassment. My scholarship focuses on feminist jurisprudence and freedom of expression. So I published an article talking about street harassment from the Victorian era up to today and how women's self-help measures have been more legally restricted than the street harassment itself, focusing on how women in the Victorian era, when they were harassed in public, would stab men with their hat pins. And in response, the laws in different cities mostly, but a couple states started restricting hat pins rather than deal with the street harassment. And then tracing it through to modern times and similar reactions. Okay, and then my colleague Susan Tanner, also a junior faculty member going up for tenure next year, and her focus is on AI. And her most recent article is about the how AI is being looked at under the Fourth Amendment search and seizure law. We also had a casebook that recently got published in Kentucky Employment Law, which was a joint effort by 3 faculty members, Ariana Levinson, Will Hilliard, and Joe Dunman. Will Hilliard is one of our library faculty, and Joe Dunman is another junior faculty member up for promotion this year. But I thought it was a very cool collaborative project by these 3 faculty, and it was also Professor Levinson taught employment law as a special seminar because the students helped her write her portion of the book. So it was actually a teaching exercise as well as a research exercise. We also, I wanted to highlight Scott Campbell, who's another one of our law librarians. And he is our Louis D. Brandeis, who's a former Supreme Court Justice. He is, and our school's named after him. And we actually have his private papers in our law library. So if anyone's ever interested in looking at anything related to Brandeis, we have his private papers, and the librarians would be happy to organize a tour. There's a special room just for them. It's very cool. But Professor Campbell, he published a chapter in a book. He edited a collection of things about Brandeis, about talking about democracy and social justice. And I thought it was also funny that he published a related article talking about his journey in becoming a Brandeis scholar based on his work in the library. So a nice little synergy that he got an article out of a book he edited, which I thought was very funny and cool. We also have just interdisciplinary work that's being done by our faculty. One of them is Julie Campbell, who co-edited a piece about do not resuscitate do not resuscitate orders. I don't know. This was Professor Campbell, another junior faculty member, but she does health law, and so this was published in a medical journal rather than a law review. And then we have Cassie Chambers Armstrong, who did a piece in the Rural Review about the impact of place on domestic violence protective orders. Professor Chambers Armstrong, another junior faculty member, or junior faculty members are killing it, but published a piece, not a law review article, but more of a commentary, more publicly accessible piece about how being in a rural area can impact your the court, how the courts treat you, and how you interact with the courts dealing with domestic violence cases. Okay. I also wanted to emphasize our community engaged scholarship. Dr. Tony Arnold is one of our primary community engaged scholars. He does the Resilience Justice Fellowship and Practicum. And so this is a class being taught to students, but the students, instead of just learning about these, about resilience justice, they actually create memos and reports that are used by our community partners. And so this year, the community partners were the Parks Alliance of Louisville, the Great Salt Lake Project, the Kentucky Tenant Union, SAGE, and Sweet Evening Breeze. So these were all community partners that benefited from the work of Dr. Arnold and his students working together to create reports that were and memos that were helpful to these community organizations. And then the last thing I'll do is just talk about some forthcoming works that I was informed of by some of our faculty. Minota Nkobo, again, junior faculty member. He has a law review article coming out in the fall about judicial independence and constitutional fidelity. So again, really thinking about the courts and judicial independence compared to Professor Markison talking about the executive branch and executive powers. And then Professor Mark Murphy, who's actually a professor of practice, so doesn't even have a scholarship requirement. They are a professor of practice at the law school, are experienced lawyers in the community that teach and provide service for the law school, but they do not have a scholarship requirement, but he just couldn't help himself. So he wrote an essay and designed the cover art for an anthology called We the People, The Stories Beneath the Constitution. This is for the Constitution's 250th birthday. And Professor Murphy is also a cartoonist for the Courier Journal and other publications. You have probably seen his work. So I will stop sharing there, just kind of a glimpse as to what our law faculty have been doing on a wide variety of projects and things that we're really proud of, and the impact that they're having on the legal academia, but also on our communities.
Thank you so much. Very interesting work. I'll admit I didn't know much about the scholarly work being done in the law school, so I appreciate you sharing. Our last presenter is Dr. Carl Maertz, and he's from the College of Business. He's going to talk about working with co-authors and some lessons learned and tips. And I'm particularly interested in how he identifies, possibly at the beginning of a project, research project, or scholarly activity, how to identify the right co-authors and whether they make an agreement at the beginning or if it evolves over time. Dr. Maertz?
Okay. I think it's, does that look
Yes,
all right?
yes, we can see your slide.
Let me see if I can actually manipulate that. Yes, I think I can. Is that a good view, Lee?
Yes, it looks great.
Okay. All right. Mine looks weird, but anyway, as long as it looks okay to you. First of all, I want to say great presentations by my colleagues. Unlike them, I'm not really trying to tell you about any particular projects today. Also, the business school is very diverse in terms of the kind of research we do. There's people that download data sets from, annual reports and things. And there's people like me who do basic human psychology work. There's people doing health justice stuff in the economics department. We use qualitative methods. We use very quantitative methods. So it would be really hard for me to even give an overview. That's my excuse. The reason I wanted to do this topic instead was I thought it might be somewhat helpful, especially to younger scholars. And I also feel like I was asked by some doctoral students in a doctoral seminar, tell me about how do you choose co-authors? How do you tell me stories about that? And so I started there probably about 4 days before I heard about this opportunity to present. So that's one reason. You might say, well, what do you know about working with co-authors? Well, just as an idea, I have some bona fides here that include I've got 51 refereed publications, and I've worked with, I just counted these up. I wasn't keeping count, but 63 different co-authors in my career from over a dozen countries. And I will say none of them are from the University of Louisville right at this moment. So we can talk about it if we want to. So I think I would just say overall, before I launch into what I consider to be some tips, that first of all, if you are a person who is, and I know there's a lot of you here who are, your research is really dependent on external funding, or you really don't have goals to publish, in the top tier journals in whatever your field is, then you can certainly take my comments with a little bit less seriousness, and maybe with a grain of salt. Overall, I will say that I love working with co-authors. I don't have 63 because I hated it, and I feel like I should say this: I've been disappointed and highly rewarded, and I know that there's many more people that will take my phone calls now than if I had not engaged as many co-authors. So let me try to throw a little bit of background here. So early in my career, I pretty much got dragged into, I say it that way now, I joined a lot of projects that I probably did mostly out of good-natured naivete. And I think that looking back on my first 4 or 5 years out of school and how much time I spent on some very low landing publications, at many hundreds of hours, made me kind of rethink some of this. And so I first have, what are some prerequisites before you choose any co-authors? You should probably have an idea what you're good at, what you like to do. That sounds simple, but I think it's not always that simple, especially when you're just getting started and you don't have as many experiences in publications. I would consider all new authorships and all new projects very carefully. And the reason is what I said. There are high opportunity costs to getting involved in a project, especially if you're like me and you're just really obsessed with completion. You don't want to let things go. Then you really need to think up front. And I would say if you don't have enough time to really treat your co-authors like you would your, I don't know, your doctoral committee or people that you respect in general, then maybe you don't have time for another project. And so I guess I would just tell everyone, before you get to the co-author question, decide what kind of capacity you still have on your plate. I've been overloaded at times where I really couldn't do a good job for folks. And, as you get older, as I am, you start to have some regrets about that. And that's where some of this comes from. So, but if you do have the capacity, if you do want to consider working with other people, I would suggest recruitment. I was not into this until very recently, let's say, like maybe 10 years ago, which is fairly recent for me. So the I think the issue is that most people can see, like, having someone who does the things you don't like to do or does the things that you're not able to do and complementary in some way is a good way to choose people. And what we have done at the business school with the doctoral program recently, and I've done this in my own research work, is to find people who are really famous or who are established in a certain area and approach them. And I think for the first 10 years I was out of school, at least, I was like, those people don't have time for me. They're busy. They think they're better than me, or they don't respect me or whatever. I found that to be completely false. That is, it seems like anybody I approach in a good faith way seems to at least give me an ear and is interested. So I guess that's one thing I want to say. And we have, by the way, we have recruited onto our doctoral student committees in like the last 3 years, some of the biggest scholars that are editing the biggest journals, that are the biggest names in a certain area and so forth. And it's worked out really well for our students. I guess the other thing I want to say here is that just finding someone who fits your project isn't the only reason to look and recruit co-authors. There's obviously there's learning. There's certain especially when you get an expert, like we tried to do for our doctoral students, they bring some knowledge and some articles and some ideas to the table that a lot of people would not, that are already on the project. So, I mean, learning is a big thing. Working with what I call NNA, nearby natural allies. And examples are, hey, if you're a doctoral student or you're an assistant professor, you've got a potential partner. There's people there that really have, they have to get their research going, and whether it be for tenure or whether it be for a job and so on. There might be colleagues you have with grants, with other resources, with analysis capabilities that you would never think of. Another good reason to think about co-authors. And then one is also to have some allies in the field. I don't know about the other departments, but in management and entrepreneurship, the department I come from, there's external letters that you need when you go up for tenure or promotion. And the problem with co-authors is you're not supposed to use them for that purpose. But there are many other reasons to have letters written, whether it be for jobs or for special grants, for awards, for things like this. And so, getting some co-authors that you've worked with that will take your phone calls on board is something to think about. The last one I have is helping friends and colleagues. Obviously, I've done this, and sometimes it's worked out well, sometimes not so well, but I put that last on the list. I would think about your other motives before you just go, you know what, I'm going to maybe spend hundreds of hours on a project that I'm not sure if it's any good or it's going to wind up anywhere, but it's just for a friend. I did that a few times early on. I don't do it anymore. What next? So you've recruited somebody. What do you do? I like to have some sort of a proffer. The law professors on there will kind of know what a proffer is, but basically a deal. It's a suggestion of what you might do or what you might give. And I find that these are invaluable now. And as I say on the next slide too, a lot of people who are busy, who are good in their areas, who have published a lot, they don't have a ton of time for extra authorships. So sometimes they actually welcome things like this, where you can give them a box that they're going to contribute within, and you're not going to ask them for that much more than that. And so, what are you willing to do? What are you willing to contribute? In what time frame? And then, there's always things that you want to ask before you say, well, that proffer sounds great. You're on the project. We're going to invite you on officially. I think you need to ask one more question, which is, are there any are you going out of the country for 3 months in a couple of weeks, or you're going on sabbatical, or you're going to have deadlines for other papers coming up? So I like to give them a chance to say, hey, until June 30th, I'm not going to be able to do anything, but at that time I will do this, and I will get it done by July 30th, or whatever. And so anyway, this is probably stuff some of you have thought about, but I find that it's difficult. It's difficult to do this sometimes, especially if you're trying to be respectful for people. And I still find it tough to call people in on their proffers and say, hey, you owe me something, or you've let me down, or anything that's negative, especially for highly engaged people. They got to be they've got to have a well-defined proffer, and they've got to be really late until I give them a hard time. But you do need to do that at some point. And I think this is a time to, to reiterate that. What kind of role do you expect somebody to have? A lot of times the real busy people want a very specific one, but in some cases you want those learning outcomes. You want those allied outcomes down the road might be what you're looking for in that in that co-authorship. And so you kind of have to know whether you're whether you just need some work done, or whether you're trying to build up your abilities in a given area of the field. So I just look at it where the more specific it is, the more tough you can get with people. If you're like, well, I want you to teach me all about a new area, which I've done twice with co-authors, then you really can't hold them to the same kind of deadlines, and the proffers are going to be pretty general or more general than you might have. And so I do think that the broader those are, the less expectations you can have. If they're very specific, then I think you can expect more. And just my technique is I still wait a week, at least a week, until after they've ironclad promised to have me something before I start doing it. I take that from some of the journal reviews that I do, is that I have to be at least a week late before anybody sends me a notice. And I like to observe that too. So just some thoughts off the top of my head from someone who's done a lot of papers with co-authors, and happy to take questions. I'm sure my colleagues will too, if that's the way you want to do it, Lee. Do we have time at all, I guess?
We do. Thank you, Carl. Does anyone, I want to thank all of the presenters today. Does anyone have any questions for any of the presenters? Again, thank you everyone for attending this month. I did include in the chat that our next town hall will be on June 25th. And we are highlighting and including an overview of core facilities that are driving biomedical discovery and researchers who have benefited from the drug discovery platform at the Brown Cancer Center. So please join us at our next town hall, and everyone have a wonderful afternoon. Thank you.
Thank you.